Miss Community Clovia. Welcome to another edition of Her Story RVA. It is a virtual women's empowerment series curated with Black women in mind. This episode is sponsored by Urban Baby Beginnings, and we're back. We're here with this episode because we're going to be talking about Black Maternal Health Week, which is coming up April 11th through the 17th. And we're excited to shed some light on this very important topic tonight. We're joined again. She's no stranger to Her Story RVA, founder and executive director of Urban Baby Beginnings, Stephanie Spencer. How are you?
I am doing well. It's great to see you all again.
It's good to have you. Urban Baby Beginnings is the leading nonprofit providing communities support services specifically for pregnant and parenting families here in the Commonwealth of Virginia. And I'm so excited tonight. She's no stranger to Her Story RVA. I want to reintroduce you to Candace McDaniels, who is a community doula at Urban Baby Beginnings. How you doing, Candace?
Hi, thank you so much for having me. I'm doing well.
We're back together again. And a lot of times when folks are watching, we automatically think they know Urban Baby Beginnings, Urban Baby Beginnings. We've been doing it so long. What is the inspiration, Stephanie, behind UBB? And what is your personal story behind this? And what shaped your world to make it as impactful as it is today?
Sure, absolutely. So I'm a mom of three, and I have been doing this work for a really long time. But the reality is that what really started my journey here at Urban Baby Beginnings was recognizing that moms like myself, even my mother, were individuals that were falling through the cracks and not getting the care and services that are necessary. And it was leading to the death of newborns as well as moms as a whole. And we are no stranger to that in our family either. And I knew that we needed to do more. We had several moms that were willing to come forward and to share their stories, and we banded together and started to work towards moving towards improving health outcomes and ensuring that women had support. The other part of was that I noticed that the individuals that were sharing their story were all Black women, and they just did not have great outcomes as a result of many different factors, but not being believed in the systems of care, not having access, just all kind of things. And though Urban Baby or the organization has been around for 30 years and has been in the community doing work from early childhood education to now maternal health, it was not until 2015 where we really started to say that we needed to do more support for pregnant and parenting people. And, I believe that the model that we have really worked for and why we've done this is because we want a more just society and a model that really centers love and respect and community rooted support. And it was really Urban Baby Beginnings was really born out of necessity and a vision that families needed comprehensive care from doula support to lactation through pregnancy, birth, and beyond.
Which all can affect your mental health. So that brings us to Black maternal mental health. And as you were having conversations and dialogue with these women, rarely do we talk about it. Days gone by, even if you feel like you're going to blow it, you couldn't share that because you're a brand new mother.
Yeah, yeah. And I think that people often, especially in Black communities, when you say that you are having some level of an issue, there are different ways of handling that. So we don't talk about mental health issues and the isolation that's experienced by being a new mom, or even the hormones and the fluctuations and how it just feels today to be a new mom in a society that is moving so fast and where we're really under supported. And I would definitely say that in 2015, we were also starting to elevate these issues to say that, there's more to be said than just about bringing a new baby into this world. Moms are suffering. They're having true issues. And we need to think about a well-rounded approach to care. It can't just always be about the baby. It has to be about the mother, too.
Absolutely. Thank you so much for being here. Candace, I have a couple of questions for you. Let's start here. What inspired you on your doula journey and the work that you do with UBB?
Yes, so I am a mom. I have three wonderful children, but I've also experienced a couple of losses. One of my losses in particular was a late term loss. So it was a viable pregnancy, but I was experiencing some symptoms. So I went into the hospital, and the way I was treated, I was definitely ignored. Some of my symptoms were ignored. I remember very particularly, I told the lady, I told her I was leaking, and she said, "Oh, well, how do you know? You're not just it's not just urine." When I knew that something was going on with my body, so just feeling not heard, it led to a loss, and I remember. After my loss, and I was in the hospital in the corner, I was all alone. And I just had this feeling like no one should feel like this. I don't want any other woman in my family, my children, anyone to feel like this. So that definitely spurred my interest into birth work and why we're treated differently. So that was years ago. So I just became interested in how we can support each other, especially as women of color. And right after COVID, I happened upon Urban Baby Beginnings and just learned about some of the wonderful work they were doing. And it just reignited this passion that I had to support moms and families.
Thank you so much for sharing. And that really means a lot because when something doesn't feel right in your body, it should be addressed. I don't care what
Absolutely.
it is. For folks who are watching us tonight, if something doesn't feel right, you need to have it addressed. Now, this is going to be a question for both of you, but since I got you all open, Candace, Black Maternal Health Week 2025 focuses on healing legacies. What does this theme mean to you personally and for your organization's mission, like UBB?
So when I think of, I always think of my own legacy. What do I want to leave for my children, for my family? And I am big on family. I come from a large family. My grandmother, she had 16 children, so a lot of aunts and cousins. So I want to make sure that our legacy is supporting women that look like us. I don't want my children or my grandchildren or even my cousins, my nieces, to go through some of the things that women historically have gone through, some of the things that my grandparents and my aunts went through. They all experienced losses, and those losses aren't talked about. So, making sure that we're talking about those things, we're educating one another, educating our children and those in the future generations so they don't experience what it is that we have experienced.
Candace, thank you for that. And I love the theme. I love everything about legacy and healing. And to put it all together, Stephanie, what is your take on that? What does that mean to you, healing legacies?
Yeah, I think a couple of things. The biggest thing is you cannot erase history. And, we have a lot of history in Black communities, that has really um, informed how we engage with systems today. I think that healing legacies is really about acknowledging the generational trauma that our communities have experienced, but also really uplifting generational wisdom. My One of my great grandmothers, she was a midwife in community, and so that meant that she provided birthing support for women that were where she lived. And we honor the traditions that have inspired the work that we have today, things like Black midwifery, community care, and storytelling. So being able to sit around these circles and talk to other women and tell them these stories is extremely important. And I believe that the healing part is in this Black Maternal Health Week because it really talks about reclaiming our power. I think about the Maternal Health Hub, our perinatal health hub that is providing generational support. That's 30 years of work we've done. We're going into our fourth generation of family members who are supporting this environment. And when we reclaim our power, it really allows us to center our joy, safety, and autonomy in birth. And I also think that it's about breaking cycles and building something sustainable for our daughters and their daughters, and taking away, I think, some of the fear related to the care that we're receiving and allowing us to envision what that can look like to put us in a situation where we have better outcomes across the board in Black communities.
Stephanie, that is good. Candace, your responses. Now, this is going to be another question, and I want you to respond first, Stephanie. The theme, as we're talking about healing legacies, acknowledges systematic oppression and reproductive injustices. What are some of the biggest barriers Black people or Black birthing people will face today?
Mhm. I still think we've done a lot of work over the many years, even across the United States. I feel that Black women and others are coming forward and talking about this movement to improve Black maternal health. It was something that you just couldn't say back in 2014. It wasn't, it was taboo. To bring forth and talk about Black maternal health or Black anything for that matter. And you can kind of see that's ebbing and flowing, depending upon all different types of things. But I would say, thinking about the fact that we did not have access to hospital systems, voting rights, all kind of things years ago. And that's not 200 years ago, that's within the last century that we did not have these things. And women as a whole didn't have the same level of access, and Black women did not have access at all. Everything was drawn in the community. And so going into these systems, we often are not believed and respected in the care system. And, that varies depending upon where you go. And that is a huge barrier. Access is a barrier. Access to quality providers is a barrier. Access to Black maternal health care with Black providers is also a barrier. And I think that when we know that for Black women that we use storytelling, we use community as a way to come together to help support one another, and realizing that that's not available, it is a huge issue. And so, having access to culturally congruent care alongside of wraparound services, because systems treat symptoms. They don't treat root causes. They don't look at community like that. They're thinking, you're sick. Oh, I need to help you. But that's not how Black women get care today. And it just doesn't exist in the same way.
For some reason, people think we're really, really strong, like we don't have pain. And we really do. And I'm so glad that we're having this show tonight, Her Story RVA. Now, I want to go to another question for you, Candace. How can the healthcare system take restorative approaches to improve maternal health outcomes for Black families?
Absolutely. I think that education is the key. It's necessary for us to be educated, for providers to be educated. As Stephanie said, access to care is so important, but also we need to make sure we're acknowledging our history. What they say, if you don't acknowledge history, you're bound to repeat it, right? So we need to acknowledge these systematic injustices that have been in place, that we have experienced, so that we can say, hey, this was wrong. We need to address this. And also, how can we fix this? So, acknowledgement of that, and then educating those providers about it. Education, education, education is what I think is going to be the main thing. We need to recognize and educate.
Okay. Thank you so much for that, Candace. Now, Stephanie, collective action is central for this year's theme, Healing Legacy. Can you share a success story where collaboration between Black led organizations made a tangible impact?
Absolutely. So, if you guys have been following the work across the state of Virginia, a couple of things that have happened as a result of Black led organizations more in the maternal health space banding together. Some of those are the influence related to having access to doula support across the state that is funded through Medicaid. And we've been advocating for commercial insurance to also cover doula support for people across the state as well. That's a huge, huge win for all of us banding together. I would say also another thing is not only just the expansion of Medicaid, but the expansion of Medicaid for special populations as well has allowed for women of color, those who maybe don't speak the English language as a primary language to have access to care. And then also expanding that through that 12 months so people can access their primary care providers. They can continue to, get the medications that they need and things like that. And so that's a big win here in Virginia. And, that was a result of all of us really banding together to talk about this and impacting the communities as a whole.
Well, thank you so much for all of the impact you're doing. And we want our viewers to stay connected to you. What's your website?
Our website is www.urbanbabybeginnings.org.
Mm, That's really short, sweet, and simple.
You don't have to guess on that one.
I know that's a good one. All right, Candace, what roles do community doulas, midwives, and advocates play in advancing Black maternal health, and how can we better support them?
So community-based doulas, as well as midwives, we are in the community. So, right, we are working in the community with the moms. We are in the community where you are. So we're trusted in the community. So we are able to support these families. So that's how we are advancing, supporting them, educating the families. Like I said, when I had my loss, I didn't know I could say, hey, something is wrong. It was just whatever the doctor said is what it was. I didn't know that I had the right to say, can I get a second opinion? Can we wait? Can we see? Can we run some more tests? I didn't know that. So educating our clients about that, empowering our clients so they feel that they are part, this is their birth story, this is their right, this is their body. So they have the right to speak up and their voice matters. As far as how we can continue to support our doulas and midwives, definitely advocacy. We know that doulas make a difference. So if doulas are making a difference, why aren't doulas covered by insurance companies? So we need access. We need financial support. Doulas are spending a lot of time with clients doing a lot of work, which they aren't adequately compensated for. So we need these systems to be paying for these services. A lot of systems, a lot of insurance companies aren't covering our midwives. We need to recognize that just because this person has an MD, they're not the be all of the support. We can work together with doulas, with midwives, with their advocacy to make sure these patients have the best outcomes.
It's so important. That's something from years gone by when you think about a doula, a midwife. Oh my goodness, I'm just going in the hospital and have my baby. You need lots of support, whether it's the husband, the wife, or family members. So please support the doulas, and you can get more information. Just go to the website at urbanbabybeginnings.org. That's urbanbabybeginnings.org. Now, how can everyday people like us, Stephanie, whether it's parents, healthcare providers, or advocates, support policy change that protect Black maternal health?
Many things. So, one, I just want to go back to a question you asked about like restorative practices, and restorative practices mean returning power to the people. And we have to be able to listen. We need to fund Black-led organizations, and we need to ensure that care is co-created. And that means that we also need to be at the table to do all these things. And so, as an individual, like what I realize, I tell the moms all the time, Urban Baby Beginnings was built because you all trusted us enough to do this, and we continue to uphold that generational legacy. It's so that other women like you can get this care and services and support. And that came from sharing a voice and trusting us enough to be able to do something. And I know sometimes that's really hard because when you're not in tables where you're represented well, or you're not sure if you can trust the individuals with your story, we tend to not share that information. So I do think it's extremely important to make sure that we are sharing our voices in the community. We need to share our stories with trusted support structures. We need to support local organizations and demand funding for services that help to transform outcomes. So, like as an example, there was a lot of advocacy at the General Assembly this year to fund Urban Baby Beginnings maternal health hubs. It was a perinatal health hub bill, and that went through the General Assembly because the governor put it in his funding package. And however, we need to make sure that that funding gets to these 5 maternal health hubs. And that is related to people uplifting their voices. I would also say in the advocacy space that when we start talking about things that are needed from a funding perspective, like now I'm talking about diapers, I'm talking about car seats and pack and play, safe sleep, how we protect our babies. That's not often covered across the board for through Medicaid services or services in general. Like there's a car seat program, but it doesn't, it doesn't provide car seats for babies that are less than 5 pounds. And there's pack and play programs across the state, but it's not consistent across the board. So that means to create a safe space for your baby, if you have, barriers to finances, you can't necessarily get that care and support. And so we're trying to uplift people's voices to talk about this and to ensure that there's equitable access. I also will say that families need to, well, two things. One, yes, they need to push for these hubs to be available because they are community rooted. They are rooted in the voices of individuals who have stated that this is extremely important. And so when you go to a local hub, you should be able to be connected to services and support that are community based, not something that's necessarily run by hospital systems and the like. And we have a role in changing, healthcare system. And also, too, we have to ensure that data is equitable, that when data is shared, that it's shared through the means and the lens of community as well. And that's not often available. And that's what we're fighting for now. We're around the governor's data task force talking about this because yes, it's great to hear from larger systems and the care and services that are needed and to get data from that perspective. But the reality is if 98% of my families are saying that they cannot get access to a class or a support group that is relevant to them or reflective of them, but that's not in the data, that's a problem, especially because, more than 70% of the women we're serving are women of color. And so we've got to think about how data is accessible because that informs what happens from a policy perspective.
And speaking of policies, this comment is Soul Express comment of Miss Community Clovia. We have an election that's coming up. Our local races that are coming up, and 100 seats are up for grabs in Virginia's General Assembly in the House of Delegates. And so every legislator should be talking about this because I'm pretty sure all across the Commonwealth, we got Black pregnant women.
Mhm.
So these should be issues that we take up with Virginia's General Assembly. And of course, we're not making this her story about policy change and political, but in order for us to hopefully get money continuously in the budget, we have to speak with the legislators. So I just wanted to put that in. If you're thinking about, Stephanie, another policy that could be in place for Black maternal health, what would it be and why?
One of the things that we've really been promoting this year is access to trying to help rural services. So Black women living in rural environments where there's a lack of access issue, there's a broadband issue, and then also, services for providers, even telehealth services and things are very, very minimal. And we need to really be thinking about access to care services. So things like going back to looking at the pay disparity for midwives to ensure that we're able to expand that as a provider type, allowing providers that are serving pregnant women to practice at the top of their license. And so what that means is that if I'm a midwife and I have care that I can provide across the spectrum for women, I should be allowed to be able to do that and to be reimbursed for those services through Medicaid. And I think that that's something that's really big that is being fought for right now because in the rural areas, there are more midwives that are out there trying to take care of individuals because there's a lack of access to hospital systems. So we need to really be thinking about that. And there are more rural areas in the state than people are, I think, really aware of. And right now they're landing in the hospital and having to drive an hour or more away to even get basic care. And that's a huge safety issue. So we need to be thinking about that.
And I'm glad you did touch on that as well. Now, again, for folks that are joining us, thank you. What is the difference between a community-based doula and a midwife?
So a community-based doula does not provide clinical care services. They may see women for a period of time, generally pregnancy throughout the postpartum period for a few months. They're not doing things like checking your blood pressures. They're not doing, urine tests or ordering tests by, at the lab. And they're definitely not checking on fetal heart tones and making sure that you're safe in your pregnancy. I say that doulas are that emotional support. They're the ones that reduce that isolation you experience, and they can help validate you and let you know it's okay to keep moving forward. Whereas the provider, or the midwife, though they provide holistic care, they really are trying to make sure as well that mom and baby are doing okay clinically.
Okay. Well, thank you so much for clearing that up for me. All right, Stephanie, I got another question for you. And then, Candace, we're going to be back. What is one actionable step listeners can take today to support Black maternal health and be a part of this collective movement for change?
One, they can share this information with families and friends. Can become an ambassador, because now everybody that's listened to this, I'm saying you're a maternal health ambassador for Black maternal health, and you should feel comfortable with going and talking to your family and friends, because that's the only way we can keep each other safe. I think one of the things they can do as well is to point people in the direction of a maternal health hub, one of Urban Baby Beginnings hubs, either in Roanoke, Norfolk, Richmond, or Petersburg, because they can make sure that their families get the care and support that they need. And then last, being an ambassador also means that generationally you can pass stories down now, and you can share information with people about this movement, making sure that they get care and support. And also just continuing to educate yourself, and all of these things I gave are free. And our stories matter, and we can uplift our communities just by opening our mouths, opening our door, trusting a system. We've been together for a couple of years now just talking about this. So I want to see everybody to take charge, and again restore that power, because we have it.
And it is so important having shows like this. And I'm just amazed. Love the partnership with you, Stephanie, and Urban Baby Beginnings, and all of the special partners that you do have joining us to actually sit here and have a conversation with the real life doula. All right, Candace, anything else you would like to share with our listeners before we and our viewers before we leave?
I would say that Urban Baby Beginnings, our maternal health hubs, are so much more than just doula. When you come into our hubs, you get a full on system of support. We are all about lifting our clients and our community up. So, if you need additional resources, you need maternal health, you need mental health, you need to find out where can I go for navigation to find out this. Pregnancy all the way up to early childhood, age 2, you can come into our hubs and get the support that you need. We're truly here to just uplift our community.
That's what it's all about. And I thank you, Stephanie. I've said it over and over and over and over again. But we want women who've had healthy pregnancies with a tall village to share their stories too, right, Stephanie?
Absolutely, yes. I can remember sitting in a group, and I had young moms who were very not comfortable with breastfeeding in public, and it's a law now. You should be able to do this. And we brought in older moms who they had very good pregnancies and pregnancy outcomes, and they were breastfeeding their babies, and they sat there in that class every time we had one. And eventually, those young ladies were sitting around the table. Everybody was breastfeeding in the public area. They felt comfortable. They felt empowered. And so it's important to see success in pregnancy in the postpartum period. And that's why we have to uplift our voices too. And I do believe that success also comes about when people are talking about the fact that what they did to reduce isolation, what they did to combat some of these issues. So we need to hear from individuals like us and others as well.
Because with our ancestors or your great great grandparents, they didn't talk about anything. Whatever goes on in the house stayed in the house. And so
Okay.
now we're in this situation now, which is we're grateful that you're having this conversation. And our older, what I wouldn't say older, our seasoned mothers who gave birth and did
Mhm.
it well or had some issues or sharing some stories, it's going to help us in the next generation. So
Yeah.
I thank you again for being here for Black Maternal Health Week. It's April 11th through the 17th. For more information about all of the resources shared here today, go to urbanbabybeginnings.org. That's urbanbabybeginnings.org. Urban Baby Beginnings is our partner and sponsor. And there you have it. Her story, RBA.